In 1932, the U.S. Public Health Service recruited 399 black men in rural Alabama under the promise of free health care, then secretly withheld treatment and watched them die slow, painful deaths just to study how syphilis progressed in the human body. For 40 years, no one inside the system stopped it. What made that possible is a machinery of deception that was built into this experiment from day one. In the spring of 1932, the United States Public Health Service issued a formal order to the Tuskegee Institute. The directive was precise: recruit 600 black men from Macon County, Alabama, 399 who tested positive for syphilis, and 201 who did not. The study's architects called it an investigation into the natural history of untreated syphilis. The real purpose was hidden behind the language of science and the promise of help. Recruitment flyers circulated through black churches, corner stores, and tenant farms. They offered special free treatment for bad blood, a term that covered everything from anemia to fatigue to syphilis itself. The promise was simple: free medical exams, hot meals, and burial insurance. For men who had never seen a doctor, these were powerful incentives. Most could not read the fine print. None were told the truth. The protocol, drafted by Dr. Raymond Vonderlehr and Dr. Taliaferro Clark, outlined a plan of quarterly exams, blood draws, and spinal taps. The men would not be told they had syphilis. They would not be offered treatment. Instead, they became unwitting subjects in a government experiment designed to watch their bodies break down over time. Internal memos from the Surgeon General's office authorized the plan, citing budget constraints and the need for data on black health. The chain of command ran from Washington to Tuskegee, with every step documented, every deception signed off by federal officials. By the end of the first enrollment drive, 399 infected men and 201 controls had been signed up. Their names filled the intake sheets stored in government files. The machinery was in motion, and the numbers were no longer just statistics. They were lives, marked for observation, not for healing. Men arrived at the Tuskegee Clinic every few months, summoned by government letters or word passed through neighbors. Each visit followed a ritual: line up, wait in silence, then submit to a round of examinations. The doctors in white coats drew blood, measured pulses, and recorded symptoms on thick intake sheets. For many, these were the first medical records ever created in their names. The promise of help hung in the air, but the procedures brought only confusion and pain. Quarterly exams became routine. The men endured spinal taps, lumbar punctures, performed with little explanation. Some called it the back shot, a procedure so painful that rumors spread about its dangers. Nurses offered iron tonics and pink placebos, telling the men these would help their bad blood. The bottles looked official, but they contained no cure. Hot meals and a few coins for travel softened the ordeal, but the sense of being studied never faded. Government logs from the CDC archives show these visits in cold detail: date, name, symptoms, blood test results. No mention of syphilis, no mention of what was really happening inside their bodies. Over the years, the exams grew more invasive as the disease advanced. Some men developed tremors, others lost their sight or speech. The doctors recorded every decline, never offering real treatment. A diary entry from the daughter of one participant survives. She wrote that Papa would come home sore, quiet, holding a bottle. He never said what they did, only that the doctors told him he was lucky to be chosen. But each year he got weaker. He believed them. We all did. The machinery of observation ran for decades, collecting data as men suffered, trusting in a promise that was never meant to be kept. By the mid-1940s, penicillin had transformed the treatment of syphilis across America. Clinics in every state were dispensing the drug, and the disease that once ravaged entire communities could now be cured with a simple injection. In 1947, the U.S. Public Health Service launched rapid treatment centers throughout the South, promising free penicillin to anyone diagnosed with syphilis. But not everyone was included. A classified memorandum dated January 23, 1947, spelled it out in chilling bureaucratic language. Effective immediately, all subjects enrolled in the Tuskegee study of untreated syphilis are exempted from admission to any rapid treatment center. No penicillin or related therapeutic agents shall be administered to these individuals unless a separate waiver is obtained. This was not an oversight. It was a deliberate policy circulated to every regional health officer and enforced at the local level. While thousands of men and women across Alabama were cured, the 399 black men in the Tuskegee study were systematically denied the one drug that could save their lives. The stated rationale was scientific, to observe the natural course of the disease. The real effect was a sentence, carried out in exam rooms and recorded in government logs, year after year. Historians who have combed through the archives describe these decisions as cold calculus. The men were no longer patients but data points, their suffering measured against the pursuit of knowledge. The government's own records confirm that the exclusion was intentional, not accidental. The machinery of public health designed to heal was repurposed to watch men die. This policy would echo for decades, setting in motion the first doubts and protests from within the system itself. Peter Buxton was a young epidemiologist with the U.S. Public Health Service when he stumbled onto the truth. In 1965, he began filing internal complaints, questioning why men in the Tuskegee study were being denied a proven cure. His letters landed on the desks of senior officials but were quietly dismissed or shelved. By 1969, Buxton's frustration had reached a breaking point. He wrote a formal memorandum to the Assistant Secretary for Health laying out the facts. Men were being observed as they died, while penicillin sat unused. The response was silence. The experiment continued, buried beneath bureaucratic language and sealed files. For 3 more years, Buxton persisted. In 1972, he made a decision that would end decades of secrecy. He leaked his documentation to a journalist, Gene Heller of the Associated Press. On July 25, 1972, the Washington Post ran the headline, "Syphilis Victims in U.S. Study Went Untreated for 40 Years." The article quoted internal memoranda and exposed the deliberate withholding of treatment. Within days, the story ignited a national scandal. Congressional hearings were scheduled, and for the first time, officials were forced to answer for what they had done. Buxton's whistleblowing shattered the wall of silence that had protected the study for 40 years. His protest, ignored for so long, became the catalyst for public outrage and a reckoning that would reach the highest levels of government. The machinery of secrecy had been exposed. Now, the country demanded justice. The numbers are not abstract. They are evidence of lives lost, families broken, and futures stolen. According to the Syphilis Study Legacy Committee's final report, 128 men died directly from syphilis or its complications, deaths that could have been prevented with a single course of penicillin. 40 wives contracted the disease from husbands who were never told the truth and never given a chance to protect the people they loved. 19 children were born with congenital syphilis, forced to carry the scars of a deception that began before they drew their first breath. These figures are not estimates. They are drawn from court exhibits, hospital records, and death certificates. Each number stands for a name, a face, a family left to mourn in confusion and silence. The government's own files confirm the toll: 128, 40, 19. The harm is measured not just in data, but in the generations forever changed. The court case that followed forced the government to answer for what it had done. In 1974, a federal judge approved a settlement of $10 million for survivors and the families of the men who died. The money was meant to pay for medical care and compensate those left behind, but no one faced criminal charges. Years passed before any official in Washington spoke the truth out loud. On May 16, 1997, President Bill Clinton stood before the remaining survivors and said, "On behalf of the United States government, I want to say we are truly sorry. We recognize that the study was a shocking and disgraceful violation of the trust that the American people placed in the government. The wounds, however, did not close. Today, Black Americans are 27% less likely to participate in clinical trials than their white counterparts, a gap traced directly to the legacy of Tuskegee, and a mistrust that still lingers in exam rooms and hospital corridors across the country. Medical racism isn't history, it's a living wound. Decades later, studies show Black Americans still distrust healthcare at higher rates, and for good reason. The machinery of deception may change shape, but its shadow lingers. What we ignore today, we risk repeating tomorrow. Share your thoughts below.